Okay, I want to talk a little bit about how often you should come for treatment. And that very much depends on your lifestyle, what your job is, the severity of your condition to begin with. And what I would say is really you need to take the advice of your chiropractor or your osteopath in order to determine what is right for you. So a little discussion between the two of you, I'm sure that you will determine what is appropriate for you in no time at all. Now, just to put things into perspective a little bit, I get adjusted every 1 to 2 weeks, just as a matter of course. I don't have any symptoms, and it's basically so that I can keep my body functioning and be as healthy as I can possibly be. I want to make sure that I prevent any problems and that anything that happens in my life, it gets nipped in the bud as quickly as possible, okay? And I also want that for my family. So my family get adjusted every 1 to 2 weeks as well, just as a matter of course. If I go back to when Clary was first born, so he got adjusted within hours of being born. So the first day that he was born, I mean, admittedly, I needed a few hours to recover before he had his first treatment, but he got adjusted on the day that he was born because I wanted to make sure after he'd gone through that traumatic birth process, because it's traumatic on mom and on the baby, that he was his body was working to the best of its ability. His body was functioning as good as it possibly could be, and he's continued to be adjusted or at least checked every 1 to 2 weeks. And every 1 to 2 weeks, if he needs an adjustment, he gets one. If he doesn't need an adjustment, he doesn't. It's as simple as that. But that's the level of care that I want for my family. Now, if you're talking about research has shown us that if you go longer than a month in between your sessions, or in between having an adjustment, if you go above a month, then you lose the benefits of the visit before, okay? So ultimately, when we're treating you, what we want to do is each treatment, we want it to be building on the one before, because otherwise what happens is you start to be just a roller coaster. So you feel better for a little while and then you drop off again, and then we adjust you and then you feel better and then you come down again, and so we're doing this. But what we want to do is make sure that every time you get a treatment, that you are being elevated every single time. We don't want you to have the slump down and the drop down. So that's why when we developed our membership was, we decided you were never going to go longer than a month, because that didn't make sense. It doesn't make sense to us and the way that we work, because the fact that we believe that we want to keep your body as good as it can possibly be, and we want to maintain the improvements that you've got, we want to prevent future problems, but then we also want you to be as well as you can possibly be. So if you're wondering about the frequency of care, discuss it with your chiropractor or osteopath. They will give you guidance based on your lifestyle, so give them as much information as you possibly can. It'll be based on your lifestyle, what your job is, the severity of your condition, the length of time that you've had your condition, all those sort of things, and that will determine how frequent you need to come in for your care.